The Bladder Meridian technique as used in this sequence is a form of energy work that follows the Bladder Meridian line beginning just behind the eye and extending to the coronary band at the top of each hind hoof. The hand held near her body along this meridian effectively bypasses her instinct to mask and hide pain. The posturing with her right front leg and the fussing and fidgeting all indicate how much discomfort she feels at her pole. Her tension release is indicated by licking and shaking. It will be frequently mirrored in the sympathetic response of the horse at the right of the screen. Her pulse rate is clearly elevated, seen in the artery just below the muscles in her neck. As the energy is maintained, she begins to relax. The shaking and licking intensify, and then she seems to swallow her tension and her eyes go soft. Her pulse continues to spike while her overall posture is more relaxed. As the focal point moves down her neck, the frame rate now has been significantly increased, and it amplifies and magnifies each of her responses, which are, for the most part, less pronounced. She restlessly shifts her weight from front to back, fussing and fidgeting. Then, when flies have clearly become an issue, a pause for some deterrence. Reassessment at the pole finds much less reaction the second time. And although she begins to relax, her pulse rate jumps again, in dramatic contrast to her lowered head and almost fluttering, half-closed eyes. Along her neck, she twitches, blinks, ears flicking. As the focus moves toward the base of her neck, her pulse seems to fluctuate, while her overall posture appears generally relaxed. Muscles in her neck and chest seem to twitch and convulse. Along her back, the pulse spikes again. The process is punctuated by a few more abrupt responses. Then, a wayward kitten gone missing for almost 5 days comes leaping and calling across the paddock outside the barn, requiring heroic intervention. And the process continues. approaching her loin, her tension begins to build again. She drops a leg and shifts. Her pulse, however, seems to have returned to a more normal rate. Her ears clearly anticipate pain. Her tail becomes active. Everything culminates at the sacrum, her reactions demonstrating the intensity of her pain. She fusses and shifts. Then it begins to subside. Gradually she relaxes and exhales deeply. Sharp tail swishes. Then her ears shift forward. Followed by more tail swishing and deep abdominal breathing. The process continues down her hip and leg. She squares up her stance, and her ears shift forward again. Some twitching, deep breathing, licking, a stretch to the floor, and extreme sympathetic release at the right of the screen. More deep breathing. Head shakes. A sudden extreme exhale. Another stretch toward the floor. A tail swish. Then another, and her hip relaxes. Twitches and deep abdominal breaths. Licking. On her opposite side, a check for TMJ yields some responses that quickly clear. Her stance now, with her right front extended, is probably not significant, merely representing the point where that hoof landed. The pole seems mostly clear. Amplified again by the increased frame rate, her head and body twitch and jolt as nerve endings fire intensely. Reactions along her neck are almost identical to the opposite side, including the elevated pulse. As she breathes deeply from her lower abdomen, her neck, head, and ears repeatedly twitch and convulse reflexively. Deep exhales, more head and neck twitching. These reactions continue into her back, although her pulse seems to be more erratic. Her eyes and ears remain soft and relaxed. Even at the loin and sacrum there is little response, mostly blinking and twitching. And then, about halfway down the muscle crease, called the poverty groove, a deep stretch throughout her entire body. She squares up her stance and takes in this new physical experience. Down the rest of her leg, the responses are mostly minimal. Deep breathing, soft, reflexive movements, eyes and ears relaxed. At a point below the hock, a larger reaction. Then softer, more subtle releases again. And the process is complete.